I can go one better than that. I heard of a case where, don't understand how this happened, but they had Belkyra in the fridge or in the cupboard,
Yeah.
as well as Botox.
Yeah.
Or maybe they're doing it on the same patient.
Oh my God. Jeez.
Yes, and they drew up Belkyra because they used
swelling?
they used to use the same.
I normally don't get swelling when you do my crow's feet.
Yes.
That looks like a Klingon.
So tell us some stories about multiple injectors and drama. I want to hear some juicy stories.
Juicy stories. Oh, you know what the interesting one is when you've got multiple injectors using the same room and someone does a different dilution on a toxin and doesn't tell the other injector or doesn't make it known within the clinic. So someone that might be doing, for example, someone that gets like a 300 unit vial of Dysport, for example, but thinks it's a 500 unit. And screws up the dilution, but doesn't tell anyone else. So they're aware of it, but they haven't told anyone else.
So how does that get picked up?
Oh, well, when patients come back and something's gone wrong with the treatment and they've been dosed incorrectly. Or some people have, like to inject with a lower dilution and a higher concentration, and they've adjusted their technique to that. So just making sure that, as simple as it sounds, that everyone is across the dilution protocol, and if you do stray from that you let everybody know. Maybe you label that bottle, you write on it, put a sticker on it. It has happened before. Cleanliness between rooms, people having shared pots of local anesthetic that they're sort of dipping their fingers in and using it on people, even if you're using a glove and putting it in people's faces and then double dipping back into it again. I've seen that stuff happen before, which is not good.
See, as far as I'm aware, that kind of stuff has stopped because both from a sterility issue.
It still happens in some clinics, Jack.
Oh God, it's
not mine, but
it's absolutely disgusting. But also, with the Poisons Act and so on, if you're going to have a compounded drug, it needs to be made in someone's name. So it can't be David Segal's massive pot of local anesthetic then used on Sally.
Communal tub.
I mean, it sounds so silly, but that stuff does happen a lot.
Yeah.
But it's the sterility thing that's awful. And if you got blood on your gloves and God knows what on your gloves, or you've had your finger in someone's mouth because you've been massaging their lips or whatever,
be surprised. Yep. Even things with the diluent. Is it
diluent?
Diluent.
Yeah.
I've seen someone reconstitute Botox with hypertonic saline before and inject it into somebody.
Hypertonic?
Yeah, they were using it for...
That must have been fun.
Oh, it was horrendous.
This is a long time.
Battery acid. Yeah, well, they were... So what happened was this practitioner also did varicose veins. Right. And so that's why the hypertonic saline was there. And they injected it, this patient, with hypertonic saline.
Holy shit.
Yeah. It wasn't good.
I can go one better than that. I heard of a case where, don't understand how this happened, but they had Belkyra in the fridge or in the cupboard, as well as Botox.
Yeah.
Or maybe they're doing it on the same patient.
Oh my God. Jeez.
Yes, and they drew up Belkyra because they used to use the same.
I normally don't get swelling when you do my crow's feet. Yes. Looks like a Klingon.
And sadly, they drew up Belkyra thinking it was toxin and did a Belkyra in the upper face rather than the submental region. And, quite understandably, that patient had quite significant pain with each injection. They couldn't work out why until after. Luckily, there were no long-term side effects, like craters in the forehead.
Yeah. Something weird that I have seen happen, and someone told me this story, I wouldn't believe it, but I saw it because I was in the room at the time. It's not even a compliance thing. It's just a funny story. Not funny, freaky story. Botox client, HIV.
All right. Okay.
Injecting Botox. Did one injection point, I think it was around the sort of like the sort of lateral head of the brow.
Before. It's not funny, but
no. So injected one injection into sort of near the glabella, and then went to do the next injection.
Yeah.
And as they injected the Botox in, it came out of the other injection hole and squirted this person in the eye.
Oh God.
Yeah, and this doctor was freaked out, like months of blood tests.
Wow.
Yeah, I don't even know how it happened. I didn't even think it would be possible.
I've never seen that before.
Yeah.
I mean, joking aside, and I shouldn't laugh. It demonstrates, even in theatre.
They started wearing goggles after that.
Oh yeah, going back to theatre, when we had an HIV patient, everyone would take double precautions, with double glove, would make sure everyone's got eye protection on, etc. So, and you'd warn everyone, this patient is HIV, just be extra vigilant. So if you're an injector and you know that your patient's HIV, definitely double glove.
Yeah.
And definitely wear some eye protection.
Yeah, because
it just seems so obvious. But again, I don't know why we lose that translation of what you'd always do in a medical setting like a hospital into an injector room. Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.